In the 1800s, phantom limb syndrome was a very common condition. It's not that well known about these days, but many people still suffer through it. Essentially, it's when an amputee still feels like their missing limb is attached to their body. They describe it as hot flashes of pain that makes them feel like their missing limb is paralyzed. The first step to understanding phantom limb syndrome is understanding sensation. Our skin is covered by touch receptors. These touch receptors send information to our brain through electrical pulses about everything it comes in contact with. The electrical pulses are then sent through the spine to the central nervous system in your primary somatosensory cortex, a part of your brain. This is the part of the brain that receives and processes all the information the receptors send them. One theory suggested by neuroscientist Ramachandra was that maybe these phantom feelings weren't created by ghosts, as was once believed, but by the major reorganization of the somatosensory cortex, also referred to as neuroplasty. Commonly used treatments are drugs such as analgesics, sedative hypnotics, and antidepressants. Other drugs, such as ketamine and calitonin, can be administered prior to amputation surgery to lessen the likelihood of later pain symptoms. Coping techniques like hypnosis, progressive muscle relaxation, and biofeedback can help some patients. Non-surgical treatments include shock therapy, acupuncture, and transcutaneous electrical nerve stimulation. A newer treatment is the mirror box, created by Villanur S. Ramachandra at the University of California, San Diego. The mirror box uses mirrors to give the impression to the user's brain that they are moving an affected limb. The therapy has had some success in alleviating pain associated with learned paralysis, often experienced by either patients whose missing limbs were paralyzed prior to amputation or patients born without a limb. The box, which does not have a roof, contains a mirror in the center and usually has two holes, one through which a patient inserts his or her intact limb and one through which the patient inserts the phantom limb. When the patient views the reflection of the intact limb in the mirror, the brain is tricked into seeing the phantom limb. By moving the intact limb and watching its reflection in the mirror, a patient can train the brain to move the phantom limb and thus relieve the learned paralysis and associated pain. Although it is still not known why phantom limb syndrome exists, I hope that one day, with time and research, there will be a permanent treatment for all amputees.